the first thing we're going to do is just definitely acknowledge who is joining us. And I know it's a small crowd, but when we do this presentation is normally geared to either parents and guardians, sibling and partners, or even aging caregivers. Your parent, your sibling, your spouse, every single day, you're taking care of someone with an intellectual disability or an aging adult. This is extraordinary work, but it's also exhausting. So this conversation will be ways that we can prevent burnout, or if you already have burnout, ways that we can reduce or mitigate some of the factors. So I'm going to first of all talk about who we are. So my name is Dr. Benson Cahill. I received my doctorate from Seton Hall 5 years ago. I've been a nurse for over 20 years. 15 of those years have been spent in nursing administration. My company, it's really my wife and I. We provide two kinds of services. The first one is through what's called HCSF, Healthcare Service Fund. So we provide services to adults, regular adults. This is home health aides, CNAs. This is regular services at home. What I really enjoy about part of our business is we provide services to adults with intellectual disability. So anybody over the age of 21 who, after they have met Niasia, we would have a conversation and Niasia would send me the ISP and I would take it from there. So we have DSP staffing, we have behavioral support, we have BCBAs, we have clinical oversight, and this is through New Jersey DDD. The difference between us and many other companies is we offer a doctoral level clinical leadership. What we do is exceeding the basic requirements by DDD standards. So we try to ensure that we're providing a caring, compassionate, and competent service to all our clients. So we provide community-based support, individual support, respite, and or transportation to and for some of the activities. So we definitely enjoy what we do. I truly enjoy and I love what I do. Our processes include meet and greets with families. And part of this process is to ensure that the caregivers are not exhausted. Once my staff come to your home, we're here to take over, right? We're here to supplement, we're here to work with you to make sure that everything is being taken care of. The next slide is I'm going to have Dr. Chris Tukum talk about who he is and a little bit about his expertise. Dr. Chris?
Yes. Good afternoon, everybody. My name is Dr. Chris Tukum, doctor in nursing practice. I graduated a couple of years ago in UMB&J. Today they call it Rutgers University. That is when I had my GMP as far back as 2012. I've been a nurse for a while, almost about close to 20 years now, and with full of experience in, I first of all did critical care before I ended up in psych. I have been a critical care nurse practitioner, but presently practicing as a psych nurse practitioner. I've worked in RWJ and some other hospitals. Finally, I decided to come out and make what we have today as a Christian Care Clinic. What is Christian Care Clinic? Actually, it's a comprehensive and personalized mental health care providing psychiatric and behavioral health services to children, adolescents, adult, and family with a focus of emotional wellness and quality of life. Who do we serve? As I said, we serve children, adolescents, and family seeking compassionate mental health and psychiatric support. Our approach is personalized, compassionate psychiatric care that focuses on emotional wellness and long-term quality of life. What is our goal? We are here, we make sure helping every patient achieve stability, healing, and lasting mental wellness in supportive environment.
Dr. Tukom, you can discuss some of the
Okay.
services that you offer.
Yeah. So the services we offered comprehensive mental health services, which is tailored to individual, either in person or via telehealth. So what we offered include psychiatric evaluation, which is a comprehensive assessment and diagnosis, medication management, which is the ongoing monitoring and adjustment of medication as per need at that time. We also offered therapy and counseling, which include individual therapy, group therapy, as well as a family support session. There's also a substance use disorder, which is integrated treatment and that include recovery support. As I said, we offered telehealth and inpatient services, which is very, very flexible for everyone, no matter where you are. You don't need to come to the clinic before we care for you. Okay. Our condition that we treat, our clinicians are experienced in a wide range of mental health and behavioral conditions, providing evidence-based care for every patient. And remember, in this situation, it is patient-specific. No two people have the same condition and situation at that time. So we offered depression and anxiety. We care for mood and anxiety disorder, bipolar and schizophrenia, which at this aspect is a little bit serious, mental health management. We take care of children of all ages with ADHD and autism spectrum, which falls under neurodevelopmental evaluation and care. Then we also look at PTSD and stress disorder, which is under trauma-informed treatment and recovery, as well as addiction and behavioral health, like substance use and behavioral challenges.
And I'm going to discuss this real quick. So I just want to discuss and identify what exactly is caregiver burnout. So this is a state of physical, emotional, and mental exhaustion. And this is, I'm definitely using the dictionary um, identification of what caregiver burnout is. It's a state of physical, emotional, and mental exhaustion that occurs when the demands of caregiving consistently exceed a person's resources, support, and recovery time, right? Um, some of the data that we have is 53% of IDD caregivers report clinically significant stress, right? I believe Liu mentioned that he's feeling it and he's looking to find ways to reduce some of the burnout. 40% of the family members meet criteria for clinical depression. 3 in 1, which is 75% of the individuals, say they have no one to give them a break, right? So burnout, it is not a sign of weakness. I definitely want to stress and emphasize that. Burnout is not a stress of weakness or lack of love. It is a predictable clinical outcome where caregivers are unsupported. It is preventable, and that's what today is all about. Part of my processes as a director of ROKAH is when I'm creating steps and processes for my staff, the first thing that we have a conversation with in front of the families and with my staff is how do I prevent their caregiver burnout? You're not able to care for somebody if you yourself, you're not caring for yourself. It is extremely, extremely hard. You're trying to give 110% while you only have an empty gas tank, right? So it is identify ways that if you feel that you're going through burnout, this is where somebody like Dr. Christy Kuhn would come in and would have a conversation, schedule a session, and stuff like that. Signs that you may be burning out, and this is a self-check. So I'm going to begin with the physical aspect of signs of burnout. So physical, chronic fatigue that sleep doesn't fix. Sometimes you might be exhausted. You take a nap, a power nap in the afternoon, 2 p.m. to 3 p.m., and you wake up fully refreshed. You go to bed at 10 p.m., wake up at 6 a.m., and you wake up fully refreshed. That's not a sign of burnout. The burnout is when you're spending over 8 hours a day sleeping and you still wake up exhausted. You're waking up with headaches, illness, body pain. You're neglecting your own medical appointments. It is many, and I do have some clients that the parents are undergoing through their own medical conditions, but they have not seen a doctor in 6 months, a year. They haven't had an x-ray, lab work. They haven't gone for a dental appointment. They haven't had coffee with a neighbor, with a friend. Why? Because they are fully focused. And I completely understand. This is out of love. But if you're not taking care of yourself, it is hard to take care of somebody else. So the emotional signs of a burnout include feeling trapped, resentful, or hopeless, crying more than usual, or just feeling numb. The loss of joy in things I used to love. So if you used to be somebody who used to love gardening, and all of a sudden you don't feel like you want to go outside and plant or anything, you're disgusted by the thought of gardening, you might be going through burnout. The mental aspect, and this is where Dr. Christy Kuhn would come in, is difficulty concentrating on making decisions, constant worry that doesn't turn off, feeling like nothing you do is enough. You're providing 24/7 care to your loved one, and that one is still not enough, right? How much more can you give? In terms of relational signs of burnout, withdrawing from friends and family, snapping at the person you care for, right? And feeling completely alone in this. And I have seen a husband and a wife snapping at each other. I have seen the caregiver snapping at the person that you're supposed to be providing love. And this is not because of anything. And it might be something very little, but you get irritated really quickly. You are exhausted. You need to find a way to reduce the burnout. So, Christo Kum, I'll have you just go over this real quick. You're on mute. Can you hear me? Oh, no, it's okay. Dr. Tukuma, I'll continue the presentation. So why IDD, why IDD caregiving is uniquely demanding, right? You're not overreacting. Individuals with developmental disability carry a challenge that most people will never see, right? It is unique to the individual. It varies from day to day. It varies from week to week. It varies from hour to hour. So individuals with intellectual disability, one, have a lifelong commitment. This is chronic. Unlike other caregiving situations, IDD caregiving rarely has an endpoint. The role evolves, but it never ends. It starts from once they're diagnosed, and you notice that before diagnosis, up until they're adults, up until they're aging adults. As a caregiver, you always have to plan what happens if I am not present? What will happen to my child if I am not present? So this is lifelong. This is not something that you can say, I can take a break, and somebody who does not have experience with my loved one can come in and take over. Absolutely not. This requires a lot of planning and a lot of care. Behavioral complexity includes managing challenging behaviors, meltdowns, psychiatric co-occurrences. It adds layers of stress that is physically and emotionally draining. System navigation, the DDD process, Medicaid, ISPs, behavior plans, school IEPs. This is a full-time job. This is extremely complex. This is where somebody like Naisha comes in and breaks it down point by point. Because if you try to do it alone, DDD will give you a lot of manuals, a lot of information, a lot of emails come out. It is a lot of information, and you're already dealing with your loved one. You're already dealing with the stress at home. You're already trying to make ends meet. Then you get this information where sometimes, and I do say this, it seems like French. It's a lot of words that you've never had before. It's a lot of verbiage, a lot of acronyms that just don't make sense until you get used to the verbiage. So this is why you have to utilize your support system. Your support coordinators are key. Uh, nurse practitioner, mental staff, psych practitioners are key. You got to utilize all the resources that you have. There is no day off when you have an adult with an intellectual disability. There's no vacation time, there's no sick days, there's none of that, because this is 24/7, 7 days a week, for sometimes 40, 50 years, right? Grief and ambiguous loss. This is families grieve the life that they imagined. And it is definitely difficult. You imagined your child growing up differently than they are. It is hard. The grief is real, it is valid, and it is often unacknowledged. Social isolation is whereby, because you need to provide 24/7, you're always at home, you're always alone, or you're surrounded by people who completely understand what you're going through. I have seen spouse, husband and wife alternate shifts, barely see each other, barely spend time with each other, because one person goes to work, they come home, they take over the care of the child. No parties, no Christmas, no Thanksgiving holidays, no Christmas. Loneliness amplifies every single stress. And you're doing this out of love. I completely get it. But humans, we're social animals. It is important to interact with other like beings. It is important to talk to other people, have a conversation about what you're going through. And this is why it is important to find somebody that you're comfortable with, to have a dialogue about your ongoing issues. Dr. Tkum, I don't know if you are able to unmute. And if you can't, I will continue. Give me a thumbs up. If you can't unmute. Okay, that's fine. I'll continue. I came prepared. And if anybody has a question, just put it in the chat and Naisha, you scream it out, you'll tell me to pause and we'll take it from there. So the mental health connection, your mind matters, right? So conditions that caregivers commonly develop, right? The subject matter expert to have this conversation would definitely be Dr. Chris Tkum. But if we're having technical difficulties, I am a nurse. I'm prepared to do the presentation. But if you schedule for a meeting, if you schedule a session, you would not want to speak to me. You would want to speak to Dr. Chris Tkum. He's a subject matter expert. So conditions caregivers commonly develop include clinical depression, generalized anxiety, secondary traumatic stress, compassion fatigue. This is emotional depletion from sustained empathetic engagement, and complicated grief. So this is what I want you to know. If you're a family member, if you're a caregiver, if you're a next of kin, if you're the guardian, seeking mental health support is an act of strength. It is not failure, right? You are trying to provide support for yourself so that you can provide support for the person who is the most important to you. Your mental health directly affects your ability to care for your loved one. If you find that you're going 2 or 3 days, you haven't showered, you've skipped a couple of meals, you've canceled multiple appointments, you've scheduled to meet with friends at a party and you've canceled every single time, you're going through burnout. So depression and anxiety in caregivers are treatable. You do not have to suffer. You are allowed to grieve. You are allowed to be angry. These feelings are valid. You are a human being, right? So all these feelings are valid. So asking for help is the most loving thing that you can do for yourself and for your next of kin. So I actually recently was in a flight over the weekend, coming back from the state of Nebraska, and this principle definitely applies, the oxygen mask principle. So if you have ever been in a plane, they do indicate this. In the event that there's a loss of cabin pressure, the first person that you secure the mask on is not your child, is not your loved one. You put the mask on yourself first. Why? You can't help somebody else breathe while you can't breathe yourself. So why does it matter? A caregiver who is depleted, depressed, burnt out cannot provide consistent, safe, high-quality care. This is not an opinion. This is just a fact. It's a clinical reality. If you're exhausted, if you're burnt out, you cannot provide the same consistent, high-quality care as you would if you had some rest. What does this mean to you, to the caregiver, to the next of kin, to the guardian? Protecting your mental health and physical health is not selfish. It is a caregiver strategy. Your wellness is part of your loved one's care plan. We believe that families are the foundation of quality IDD care. When we invest in caregiver wellness, we improve outcomes for the entire system. I have had conversation with family members. I have referred family members to Dr. Christy Cole. It is important if you're going through all of these issues, right? You're not alone. Seek help. So burnout prevention, what actually works, right? So for the caregiver, just trying to give you some tidbits, and I know this presentation is roughly 30 minutes to an hour. This is not the whole gamut of information, but this is just a start, right? So respite care, use it. I know DDD doesn't have unlimited respite hours for the clients, but the amount of time that you have, even a few hours a week, take it, right? This is not a luxury. It is scheduled. Schedule it like an appointment. Part of the reason that DDD and they don't love to utilize resources that they have scheduled and some people have approved respite hours. Caregivers who are providing services need to take some time off. They need to get a rest. So if you have respite care hours, please utilize it. It might be 2 hours a day. Go for a drive. Leave somebody who cares about your family member and just do you, right? Name your grief. Connect with a therapist, ideally one familiar with disability, to process the complex emotions that come with this journey. Unprocessed grief fuels burnout. And I think that's a critical point, so I'm going to repeat it. Unprocessed grief fuels burnout. So number 3 is protect one non-caregiver identity. Keep at least one part of your life that is just yours. A hobby. A hobby does not need to be a full-time job. It could be something that you do 1 hour a day, 30 minutes, a friendship, a walk. Identify outside the caregiver role is protected. Take the opportunity to find something. If you enjoy smelling flowers, designate 30 minutes a day, go outside and just smell flowers. Don't have your phone. Don't worry about anything else. Just focus on that. And it begins. When you're beginning this journey of taking care of yourself, you don't start planning for 10 hours a day. You start slowly. You start with 10 minutes, 15 minutes, half an hour, 1 hour, 2 hours, and you keep growing, right? Build a micro support network. And this is number 4. So we're discussing burnout prevention and what actually works. So number 4 is build a micro support network. Identify 2 to 3 people who can be called in an emergency. You don't need that many. You just need reliable individuals, right? By reliable, I mean somebody you can call at 2 a.m. and they will show up, right? Not somebody who you will call at 2 a.m. and tell you they will show up. 2 different things. Somebody who will be available at 2 a.m. when you need the help, right? And the way you do it is you start slow. Reach out to them when you don't really need help. Tell them, tomorrow at 3 p.m., I just want to do something for 30 minutes. If they can make it tomorrow, okay, do it another time. But if they can't make it this time, they can't make it the next time, and they can't make it the other time, the best predictor of the future is the past, right? So the only way that you can predict somebody will be reliable is what they have done the past couple of sessions. So identify 2 or 3 people who are reliable and test it out when you don't really need them. So that when you do, you already know they got your back. So number 5 is set the medical appointments for yourself. We did mention this before, that caregivers routinely delay their own care. I have family of clients before we came on board that have not had a hair appointment in a year or two, have not gone to the dentist, have not had lab work in a long, long time. So commit, make the appointments, and follow up with that. Number 6 is lower the bar on perfection. We are all human beings. Nobody's perfect, right? To err is human. We are all imperfect beings. So good enough caregiving on a sustainable basis is better for your loved one than heroic caregiving that ends in crisis. Release the guilt. You might be the best option to take care of your loved one, but you cannot be the only option. You have to find 2 or 3 people that you can reach out during an emergency, because the other people may not provide perfect care, but good enough is better than nothing. All right, so asking for help, overcoming the barriers. So common barriers is I should be able to do this all on my own, right? Caregiver was never designed for one person. Asking for help is the most responsible thing I can do, right? Number 2, no one else knows how to take care of them. You should reframe it as I can teach people. Training others takes time upfront, but pays back in freedom. Part of my process as I'm onboarding clients is the orientation. I want the family members to be present. I want them to provide guidance. I want them to show my staff what is the best way to do it. I don't come in with all the experience and say X, Y, and Z. Absolutely not. Every individual is unique. So I have the family members provide the support, indicate how we are going to do things, and then we take it from there. A common barrier is they will be upset if someone else helps. Please reframe it as my loved one adapts. My ability to keep showing up depends on my ability to rest. Because remember, if you're burnt out, you're not providing 100%. You're not able to. You're providing 50, 25, 35. You're snapping every time your loved one yawns or coughs, right? You're irritated easily. So if you think they will be upset if someone else helps, they're already upset sometimes because you're helping when you're not able to help. So my loved one adapts, and my ability to keep showing up depends on my ability to rest. Lastly, a common barrier is I don't want to be a burden. The people who love me want to help. Letting them in is a gift to the relationship. Again, you're not alone. There's always resources around you, but you're not a burden. Reaching out and asking for help is the most important and a loving thing you will do to your loved one. So your personal caregiver wellness plan. We're coming in trying to give you solutions on how you can mitigate or prevent burnout. So we'll start with your body, right? And this doesn't have to be elaborate. It's just real. It has to be real and practiced. It has to be scheduled. Don't start with long, start with short 15-minute, 30-minute increments. So 7.5 hours of sleep when possible. Right? It might sound, for some people listening to this presentation, it might sound like you have not had 7 hours of sleep in years. You're not going to have 7 hours of sleep tonight. The best predictor of the future is the past. You need to start slowly. If you only get 2 hours of sleep, your goal should be 3. If you get 3, the goal is 4, and you keep increasing it gradually. Eating regular meals. So skipping meals worsens your emotional dysregulation. Eating 3 times a day is recommended. Monitor your calorie intake as usual. If you're a diabetic, I am not saying indulge in as much sugar as you can. If you have high blood pressure, I am not saying take as much salt as you can. Absolutely not. I am indicating that you should eat regular meals. Move your body at least 20 minutes a day. Take a walk, right? If you're able to, don't start with a 20-minute walk. Start with a walk from here to the end of the road and then come back. From there, you cross the street. From the street, you go to the next block. from the next block, you walk, you just keep increasing, right? And when you're doing that, don't have your cell phone on you. Just enjoy nature and listen to the birds, right? Look at the trees. If you need to count how many leaves the trees have, that's gonna keep you preoccupied. Thousands of leaves per tree. But by the time you're done with the counting, look at the clouds. By the time you're done with that, your mind is refreshing. In terms of your body, keep your own medical appointments. This is non-negotiable. Just like the oxygen mask principle, if you cannot provide care to yourself, you're gonna get to a point where you can't provide care to the loved ones. So the next step is talking about the mind, and this is practice 5 minutes of intentional stillness. Chill, relax, enjoy the environment. Limit scrolling on the phone, right? If you're in bed after 8 p.m. and you're watching Facebook or TikTok or LinkedIn or whatever that you're doing, this is time for you to rest. Shut down. The news will be there tomorrow. Might be worse news tomorrow, right? It can wait, right? Just enjoy the moment. Journal or debrief, right? Don't carry them alone. Write down your feeling, right? And seek therapy. It is not a skill, it's not a last resort. Therapy is important. I've seen the wonders that it does to the family members of individuals who meet with acute care nurse practitioners, like Dr. Christopher. So relationships, and we mentioned this. Name 2 people you can call in a hard moment, but don't wait until it's a hard moment. Do it before. When you don't really need them, test it out. Join a family caregiving support. I know a couple of family groups, family support, 1 in 6 in Montclair, and other organizations, and they meet and they have conversations, and everybody is going through something similar to you. And when they meet and when they sit down and they are having lunch and you start having conversations with other individuals, you see that there's a common denominator. All of you are going through the same thing. Your adult child might have a different spectrum of autism, might have cerebral palsy, Down syndrome, right? Might have had a traumatic brain injury. But there's a common denominator in terms of what you do for them. Let people love you back. That sounds very, very simple, right? But allow people in to provide the care and the love that you deserve. So lastly, I'm going to talk about the meaning. Reconnect with the why you do this. Why do you provide care to your family member? Because you love them. So love yourself. Celebrate the small wins. As I indicated, you don't start with sleeping 7 hours a day if you haven't slept 7 hours in the last 2 years. So you're going to start with moving from 2 hours to 3 hours, but it has to be focused and intentional. Separate your identity from caregiver outcomes and give yourself credit. You've been doing a phenomenal job. It's only you who's been doing this and providing these services so far, but you need some help. The person that you bring in will not be perfect. I can guarantee you that. Nobody can do a better job than you can. We know that. We identify that. But somebody can do a good enough job to give you a break so that when you come back from the break, you can provide and continue providing the phenomenal support that you'll be providing, okay? So when to seek professional help and key resources. So the first thing I always say, and this is in red, if you are having thoughts of harming yourself, and this happens more often than you know, please call the Suicide and Crisis Lifeline. They're open 24/7. And text 988, and somebody just communicate and have a conversation with somebody, right? This is when you've really gone through so much that you can't deal with it. You can't handle it. Probably 5 years or 6 years ago, there was an incident right here in West Orange where a mom, unfortunately, not only took her life, but the life of her children as well. This happens. This is a reality, right? People get overwhelmed to a level where they cannot take it anymore. I'm not saying that of anything negative, but this is a fact. So if you do need help, please, please, please reach out to somebody. Seek help if you experience persistent sadness or crying lasting 2 or more weeks, anxiety that interferes with daily functioning, thoughts of harming yourself or disappearing, alcohol use or substance use to cope, complete inability to feel anything, emotional numbness, rage or resentment toward your loved one. So we have put in a couple of resources from the New Jersey Caregiver Coalition, DDD Family Support, ARC New Jersey Family Resource, including the contact information for Dr. Crystal Home. These are resources that are available. You have an option. Utilize those resources, reach out, talk to somebody, right? I forgot that I put that in there. If you are napping, this is gonna wake you up. So we're coming up to the end of the presentation. But I'm gonna indicate this, that you are worth caring for. Remember, burnout is not inevitable. It is a result of unmet needs and needs that can be addressed. Reach out to a therapist, a support group, a mental health provider, your support coordinator, or reach out to a company like us. If you reached out to me and you had the symptoms of burnout, I would reach out and I would connect you with Dr. Christopher. Why? Because I can identify burnout, but I can't treat it. I would connect you with a subject matter expert. Love yourself with the same fierce commitment that you give your loved one. You definitely deserve it. So the most courageous thing a caregiver can do is ask for help, because it means that you intend to keep going. So that is the end of my presentation. I'm gonna leave the next couple of minutes open for anybody who may have any question.